Okay, good morning. My name's Leonie Sanderson and I work as the Engagement Advisor on the Barrett Adolescent Centre Commission of Inquiry Implementation Project. And today I'm very pleased to be facilitating a panel discussion about this important work. Before we get started, I just want to give everybody a content warning. In a couple of minutes, we'll be presenting a short video, and the video contains frank discussion of anxiety, depression, suicidal thoughts, as well as descriptions of self-harm. If you or someone you know is in crisis or needs support right now, you can call Lifeline on the numbers that we've got up on the screen, or the Suicide Callback Service. The Suicide Callback Service, for those of you who don't know, provides free phone, video and online counselling for anyone affected by suicide, and it's available 7 days a week, 24 hours a day. We'll be presenting the video in a few minutes, but first I'd just like to give you a little bit of information about the project and a little bit about our panel. So the Barrett Adolescent Centre Commission of Inquiry and the government response to the Commission of Inquiry report noted the lack of consumer and carer consultation during the closure of the centre. In fact, consultation with Barrett families and consumers after the closure of Barrett was not ideal. Beyond the involvement of carer and consumer representatives on the expert clinical reference group, there was no evidence of any two-way consultation with Barrett families and consumers. There was also no evidence of a process for receiving the views of patients, families and carers, and no scope for those views to influence the decision-making about Barrett. As a result, the project to implement the Commission of Inquiry recommendation includes an almost unprecedented amount of consumer and carer participation at the highest levels and in the development and design of services. Today we'll be discussing some of this groundbreaking work with our 5 panellists. Our first panellist, and I'll invite them up to the stage after the video, but I'll tell you a little bit about them. Catherine Moody is a consumer representative on the Barrett Adolescent Centre Commission of Inquiry Implementation Steering Committee. I'm only going to say that once. It's a long title. Catherine's lived experience puts her in a unique position to provide the perspective of young people living through severe and complex mental health issues, and her aim is to improve mental health services, especially through increased understanding among health and other professionals of severe and complex youth mental health issues. Janine Kimber is a carer representative on the same steering committee. Janine plays an active role in advocating for young people with severe and complex mental health issues and their families, and is committed to ensuring the best possible care for this uniquely vulnerable group of young people wherever they live in Queensland. John Allen completed his medical training and PhD in Queensland and his psychiatry training in Adelaide. John is the Executive Director of the Mental Health, Alcohol and Other Drugs branch in Queensland Health. He's previously been Chief Psychiatrist in both Queensland and New South Wales. He spent 20 years working in North Queensland, where he developed a wide range of new mental health services. He recently led the introduction of the new Queensland Mental Health Act. Stacey Hansel is the Executive Director, Department of Education and Training. Stacey started her teaching career over 25 years ago back at her own primary school in Bundaberg. She's worked in many different locations and contexts, including rural and remote, distance ed, and small and large primary and secondary schools across Queensland as a teacher, deputy principal, head of school, director and principal. Stacey was one of the original staff members who rolled out the Australian curriculum throughout Queensland and also led curriculum reform for students studying through distance education. Gunter de Grieve is one of Australia's leading health planning and design consultants and a recognised thought leader within the health facility industry for his innovation in operational models and sustainable approach to facility and asset planning. He's the Managing Director of Distravus, the specialist consulting firm he founded to deliver strategic infrastructure advice to health service providers. Gunter's a proactive member of the health facility community, participating and speaking at conferences and study tours. So we're going to share a video today with you from the project which tells the story of one of our consumers, and then we'll invite our panellists to the stage.